Hi, my name is Nick Kurkjy, and this is my colleague Milos Todorovic. We're members of Lux Research's Bioelectronics Service. This service covers emerging technologies and market trends in the medical device space. So something that we see a lot of is infectious diseases really owning the news cycle, whether we're talking about drug-resistant superbugs like MRSA or the latest pandemic scare, whether it's swine flu or Ebola. Milos, are there any technologies that you've come across that might help calm some of those fears that even I have from time to time?
Yeah, sure. So part of the problem when it comes to diagnosing infectious diseases is the speed at which we can get the results. And there is a whole new set of technologies, so-called point-of-care technologies, that are aiming to give you results quickly and can be also used in both traditional clinical settings, but also in the low-resource settings around the globe. Mm-hmm. So, for example, one company in that space, Kurkjy, is one of the leaders in rapid diagnostics, and they have just launched their platform for pathogen detection. Their first focus is on hospital-acquired sepsis, mm-hmm. and their platform can, within 30 minutes, give you the information not only about what bacteria is causing the infection, but at the same time whether there is any drug resistance present.
What does it really mean for doctors, for patients at risk here?
Well, what it means is that now doctors can more quickly optimize the therapy, for example. So in the past, it used to be they would have to wait for a day or two before they could get the true diagnostic results. Mm-hmm. Now, within hours, they can start treating the patient and optimizing the therapy from the get-go. So that is a huge leap forward when it comes to diagnostics.
It does seem like that's more focused on developed world settings. You mentioned low resource settings. What kind of technologies are out there that can help address infectious diseases there?
Well, you're right that it sounds, at least on the surface, that a lot of these technologies are geared more towards the developed world. At the same time, there are many solutions, some of which are based on the so-called lateral flow assays, types of devices that are aimed exactly at these low resource settings. And the reason why they're especially well suited for that is that they're cheap typically. They can be operated without any substantial training, so both doctors and patients can use them. Mm-hmm. And they provide results very quickly using simple visual cues, such as color changes and things like that.
Right.
And then in addition to that, there are other types of technologies, some of which are based on the mobile health or mHealth types of devices. As a matter of fact, you can probably teach me more about that, since that is one of your areas of specialty.
Yeah, you're right. There are a lot of mHealth developers out there that are developing various in vitro diagnostics technologies. Typically, they're leveraging the processing power that you can find on a smartphone or other consumer electronics devices. One of the real leaders that I see in the space is a company called i-calq. They're using these using a smartphone attachment along with the lateral flow assay technology that you mentioned earlier, but they're able to actually take that qualitative lateral flow assay test and get some quantitative results out of it.
Yeah, that's very interesting. Although when I hear mHealth, I typically think of devices such as activity trackers from Jawbone or Fitbit. Mm-hmm. And as a matter of fact, if you were to ask people in the street, most of them would mention those kinds of devices. So is mHealth really focused mostly on those types of technologies?
I think you're right that most people think about this really hyped up area of consumer mHealth. But in our research, we've shown that there's, the clinical space is poised for really outsized growth. For example, the mHealth in vitro diagnostics space, which is pretty relevant for this conversation, is projected to grow to almost $7.7 billion by over the next decade. In that same time, that constitutes almost 3/4 of the total mHealth IVD space. That's a pretty substantial number.
Yeah, those are some pretty staggering numbers, as a matter of fact. But are there any specific reasons driving this kind of growth?
Yes. There are two really major reasons here. One, clinical applications are need to have. You need to have a correct diagnostic result in order to treat someone. You don't need to know how many steps you walked yesterday. And two, there's this idea of leapfrogging, where these technologies are low cost and they allow these areas of the world that don't really have the healthcare infrastructure that we do in the developed world, they allow them to catch up and increase the quality of healthcare and increase access to healthcare, which can have a really big effect as far as public health is concerned in the long term.
That's really cool. So it sounds like definitely that this space of in vitro diagnostics is going to grow significantly in the next 10 years or so. And we will definitely keep our eye on that space. In the meantime, if you have any additional questions regarding the topic that we covered today, please visit us at www.luxresearchinc.com or send us an email at info@luxresearchinc.com. Thank you.